What I wrote about in the latest column for TTO is about the controversy use of CDK4/6 inhibitors as adjuvant therapy for breast cancer. The two of the three of them will have FDA approvals and are on NCCN guidelines, those being ribociclib and abemaciclib, whereas the palbociclib does not have an indication in this space. The trials supporting the use of these products as adjuvant therapy were monarchE in the case of abemaciclib and NATALEE in the case of ribociclib. monarchE has been published for a couple of years, and then NATALEE was recently published in the New England Journal of Medicine this year. And what I found interesting about this is that there is some controversy about whether the results of these trials truly indicate a meaningful benefit, and therefore whether these products should be used in the clinic or not. There's a couple of papers that I read with interest, one of which was published in 2023 in Lancet Oncology and was directed at the monarchE trial. And the title of the paper was Review of the monarchE Trial Suggests No Evidence to Support Use of Adjuvant Abemaciclib in Women with Breast Cancer. So why do they argue this? They point to several problems, both with the trial and with the drug itself. First, they argue that the primary endpoint of the study, which was invasive disease-free survival, is not a valid surrogate endpoint for the more important endpoint of overall survival in patients with HER2-negative breast cancer. They point to the presence of informative censoring bias in the design of the trial, something I described in my last column as a source of bias and error that is perhaps prevalent in oncology trials today, especially those with progression-free survival as the primary endpoint. They point to the significant toxicity of abemaciclib. And finally, they point to the high price tag, which is perhaps more than $300,000 for 2 years of treatment. And from those arguments conclude, and I quote, adjuvant abemaciclib should not be prescribed to women with high-risk estrogen receptor positive breast cancer. There's a similar article that levels similar critiques of the trial, this one entitled CDK4/6 inhibitors as adjuvant therapy in early breast cancer, uncertain benefits and guaranteed harms. This was published in the European Journal of Cancer in 2024, written by different authors, and they critique both monarchE and NATALEE in their paper, arguing that the open label design and informative censoring bias are potential sources of error that could lead to false impression of efficacy. They also, like the other authors, questioned the clinical relevance of the endpoint of invasive disease-free survival, and also critique the high toxicity rates and financial toxicity of these drugs. They point to the fact that the number of patients needed to treat to prevent one invasive disease-free survival event is around 30. And given that the cost of 3 years of ribociclib is about $550,000, calculate that society will need to spend about $11 million to prevent one invasive disease-free survival event. The same authors that wrote the first critique of monarchE trial also wrote a letter to the editor of the New England Journal that makes similar arguments against NATALEE. So personally, I find this controversy to be relatively interesting and relatively important that we try to figure this out. These are high-cost drugs with real toxicities, and we want to make sure we're not putting patients through pain without gain. So I think it's an interesting controversy in the breast cancer field right now.